Hi, welcome to whatisallon4.com, where we discuss and give unbiased, transparent, and honest answers to some of the most asked questions when it calls to full arch procedures or full mouth implants. Okay, so today we're going to talk about cost. Do you want to know the inside information on why these all-on-4 procedures or all-on-X procedures are so expensive? If you have any interest in the procedure, I bet you've already probably done some research. And after you've done your research, you probably are like most people who are even more confused because of the wide spectrum of pricing. All right, so pricing can range from advertising from about $10,000 an arch to north of about $50,000 an arch. The mouth has two arches or jaws, so if you're interested in fixing both your top and lower teeth, that'd be two arches. So $20,000 and $100,000 respectively. That is a huge range. Okay, let's break this down and understand why. The factors that make up the cost of these all-on-X procedures can be categorized into the following. Who is involved in performing your surgery? And in fact, we have a dedicated podcast that just describes kind of who is involved in each phase of treatment. The complexity of the case also plays a part in the cost. Materials in the lab utilized, what type of implants are used, whether the process is digital or analog, the insurances and what part they play, and the timeline or the immediacy of the results. Also, who's performing it? Is it a franchise or large chain, or is it a boutique or specialized practice? All right, first topic. Let's talk about how the price can change depending on your surgeon or team you choose. You want a team, and I will get back what I mean by team, with experience and someone who has a good reputation among his colleagues. Someone that is sought after with more experience is typically a little bit more expensive, or at least more in line with average pricing. What is average pricing? I would say that average pricing is somewhere anywhere between $26,000 and $34,000. It's about an average and reasonable price from start to finish for a full zirconium hybrid FP3 arch. At the time that I'm recording this, we charge about $28,600 for typical arch, even if I use more than 4 implants, and regardless of how many teeth need to be extracted at the time of surgery. Pricing also depends on the complexity of the case. For FP1 cases, they require more work, justifying a higher price point. Also, if extensive bone grafting is required, or if there's severe bone loss and zygoma or tergoid implants are utilized, or transnasal implants, the price will be increased just because of the complexity increases the overall time spent on the case. Next, specifically talking about implants. There is a huge difference between dental implant companies when it comes to quality, but even more importantly, when it comes to support. You want a company that will be around for many years to come so that if you need a part, it can be easily found. Think of it in terms of a car. If you have a 20-year-old Ford, you could still get service and find parts. But if you purchased a Saturn, it would be more difficult because that company went bankrupt in 2010. The same holds true in the implant world. Because of their advertising and rise in popularity, implant companies are popping up every year. Some of this is good because it drives competition, and it also gives us choices and provides innovative advances. But I am guessing you're going to want to keep these implants for a while, so you want to use an implant company that'll be around for the next 40 years. Personally, my 2 front teeth are Straumann implants that were placed 25 years ago when I got in an accident when I was a child, and I'd still be able to get parts for it if I needed to. The top implant companies that I think are kind of in a tier 1 group that I would recommend to my family member or anybody else if they're going under this procedure would be first, kind of Straumann and Neodent. They're both sister companies. They have the largest market share globally, and they're based in Switzerland. This is what I use most of the time with my all-on-4s and also my single units. The next company is Nobel. They were actually the first ones to implement the all-on-4 technique, and BioHorizons, which is an American-based company. Definitely ask your doctor what system they use or what implants they use. They are not all created equal, and there's a substantial difference in cost between a reputable implant company and a knockoff implant company. The other thing you have to know is the implants, they have abutments that go on top of them. Those need to be compatible with the actual implants. We don't mix match with other companies because the accuracy is so much more if you stay within one company. If not, sometimes we have to remove it and start over. There is a big difference in cost between implants. The implants I use are listed for $700 for the abutment and the implant. So I do get a slight discount just because we use a high volume, but that gets expensive. Some knockoff companies that would charge are about $100 for the implant, about $75 for the abutment, or even less. Multiply that by 6 due to the number of implants used in a typical arch, and that's a huge difference. Let me reiterate, use good implants. The house is only as good as the foundation. The other main component that affects costs is the lab. And when we talk about lab, we're talking about what they use to plan and design your teeth and the material and the fabrication of the prosthesis or teeth. Both of these components have an artistic element involved in it. You want an experienced lab that can capture and design your smile, creating a natural appearance. Also, it's real important to ask what material your final teeth are made out of. There seems to be quite an increasing number of options. All have different price points, all have different advantages and disadvantages. We're going to break it down into mainly 3 categories. The first one's resin, PMMA, polymethyl methacrylate, which is a milled process using subtractive technology. And so it's like a plastic. Then there's also the 3D printed resin that uses an additive process. I have been using these milled PMMA resins for the past few years, and just recently 3D printed resins have become even stronger and more durable than some of the research going on the milled PMMA. Think about this as a really high-grade plastic or acrylic. They look great, especially for their transitional period. They're strong, and if they break, they're easy to replace. All right, the next main category is zirconia. This is a ceramic-based material. First, it starts out almost kind of looks like clay, and then they heat it to about 1500 degrees Celsius during the finalization stage. This process then turns it into more like a molten glass. It is very strong, it looks great, it doesn't stain, it's extremely biocompatible, for it doesn't adhere for plaque and food doesn't adhere to it easily, and the material will likely last a lifetime. One downside of zirconia is that because it is ceramic, although rare, if a tooth chips, it is very difficult to repair and oftentimes needs to be remade. All right, digital or analog. What does that mean? That means is the process that they're using for the surgery utilizing computers, or are they using it an old way with putting the goop and taking impressions and kind of guessing where your teeth are? Would you rather listen to a cassette tape or a CD? The quality of sound is not only superior on a CD, but is much more efficient, and you don't have to rewind it or flip it like a cassette tape. Take it a little farther down the evolution of music. Look at streaming. That is even more efficient than the CD-ROM. Now you don't even have to take your CD binder out and it never skips. The same is true for these All-on-X procedures. By completing the workup and doing the procedure with a digital workflow, not only makes it more efficient, more accurate, but it can actually lower costs. Some of the most expensive places I know still do it an old analog way by converting it by converting an old denture chairside with a lab technician kind of grinding out holes on which to put plastic to capture the implant position. This old technique will then be cured in your mouth. It takes twice as long to do these procedures. A procedure that previously took me about 6 hours to complete now takes me about 2 hours using a digital workflow. Why? Because I essentially have performed the surgery on a computer already and have everything in place. This increase in productivity means I don't have to charge as much for the procedure, and more importantly, the patient gets a better result. The next topic is immediacy. If there's one point that gets me fired up, this is it. In the All-on-X world, there seems to be a huge marketing strategy or drive that promotes getting your final zirconia prosthesis the next day, as if that's the greatest thing since sliced bread. I was watching another dentist YouTube bragging on himself how he is the only one who can do this because of his technology and yada, yada, yada. What bull. The reason why they bait you into this, listen to this, it is because it's easier on the doctor. You finish up with the patient in 2 days, the patient's already paid, and now it's kind of the old saying, out of sight, out of mind. They even try convincing you that it is better and stronger because it holds your implants in their position better. This is completely false and misinformation. Here's why. When someone goes from terminal dentition, which means non-restorable teeth, to a hybrid, or even if they go from edentulous, which means having no teeth, to a hybrid prosthesis, there are many small changes and big changes that take place and occur in the first few months. There's bone remodeling, there's soft tissue and gum tissue remodeling, there's speech adjustments that take place, and those are just to name a few. That is why I always recommend making a provisional prosthesis first. Because after 3 months, you can now update the soft tissue between your new teeth and your gums, making it fit a lot more snug and having less food get impacted into it. You can also make it thinner and more streamlined, and you can make changes in the appearance, the teeth color, the shape and the size, and the way that it contacts with the opposing teeth. So then when you're completely satisfied, what we do is we duplicate those teeth. I see a good number of out-of-town patients that travel to see me. If after I give them the pros and cons and they still want the final the next day, great. But at least I have done my due diligence to give them an option and inform them on the pros and cons of it. All right, where are you getting your procedure done? Is this going to be at a franchise or a Smile Center or a private practice or a boutique practice? There are many different types of centers or practices that have different business models on how they market to patients. Many of these franchise and Smile Centers can spend up to $10,000 to acquire one patient and to convert them to surgery. They have quotas they have to make monthly. There are incentives to produce more and more and more. So even though the price seems reasonable, a lot of what you're paying for is actually your own marketing. Also, they market the brand, not the doctor. To put it frankly, there are really good doctors and some really not so good doctors, but how do you know? Especially if it is a large national model like ClearChoice that has doctors revolving in and out or moving from one location to another. Most of my patients come from other patients, word of mouth, or they are actually referred from their dentist or their doctor. Some are price shopping and they've been to about 4 or 5 other places and then they land here because they get frustrated with all the misinformation. In medicine, though, most procedures have a contracted negotiated rate. And that's kind of where we go to talk about our insurance company. And that's even confusing in the medical field, but at least the pricing is pretty standard across different providers, depending on what location you live. That's all I've got to talk about cost when it comes to All on X procedures. If you have any questions, please make the comments below, and we'll be looking forward to answering more of your questions when it comes to providing unbiased, transparent, and honest answers to All on X procedures. Thank you.